Okay, let's talk about the lead poisoning. Lead poisoning. Lead inhibits ferrochelatase and ALA dehydratase, which leads to decreased heme synthesis and increase in RBC protoporphyrin levels. Lead also inhibits R ribosomal RNA degradation, which causes the RBCs to retain the aggregates of that ribosomal RNA, which will be seen as basophilic stippling. Symptoms of lead poisoning: there's a mnemonic, lead. That is you will see lead lines on the gingiva, which is also known as the Burton lines, and on the metaphysis of the long bones on the X-ray. Look at the metaphysis of the long bone in the picture. You can see lead lines on the metaphysis of the long bones. LE for encephalopathies and erythrocyte basophilic stippling. A for abdominal colic and sideroblastic anemias. And D for drops. What drops? You have a wrist and a foot drop. So you can just think about it in this way. You have a neuropathies, which is there. You got GI disturbances right there. And also you got, so this is more like peripheral neuropathy, and this is in neuro you have encephalopathies. So these are really high yield for lead poisoning. Treatment for the lead poisoning are chelate with succimer, EDTA, and dimercaprol. Okay. Exposure is you have increase in old houses. Where do you get the lead from? If you have an old house built before 1978, wow, they have done their research. With chip paint. So chip paint, now the children, they eat the chip paint from the walls, and that is most common in children. But for adults, they get the lead poisoning from the workplace. That's also very important. Children chip paint and adults workplace. Okay, so now let's talk about the sideroblastic anemia, which we said here, how lead causes sideroblastic anemia. Now, sideroblastic anemia is not only it is caused by lead poisoning, but it is also caused by some genetic problems. For example, X-linked defect in ALA synthase gene. ALA synthase gene. Acquiredly, you have myelodysplastic syndromes, and reversibly, you have alcohol, which is most common. Also, lead poisoning, we already talked about that it causes the sideroblastic anemia in lead poisoning. And vitamin B6 deficiencies, copper deficiency, and drugs. For example, isoniazid and linezolid. Again, they are causing the same thing. They are inhibiting the vitamin B6, so leading to vitamin B6 deficiency. So in labs, you have an increase in iron. You have decrease in TIBC, which and also increase in ferritin. Ring sideroblasts are seen with iron-laden Prussian blue stain mitochondria seen in the bone marrow. Peripheral blood smear would show basophilic stippling, same thing as seen here, basophilic stippling of RBC. Some acquired variants may be normocytic or microcytic. Treatment is you give that B6 if that's deficient. You give the cofactor, which is a cofactor for ALA synthase, which was defective in the X-linked sideroblastic anemia. Here, what is important is that you are in iron overload state. You're in iron overload state. Same iron levels as you see in hemochromatosis. And this will be the only microcytic anemia in which you have iron overload. Okay. So differentiating feature between the lead in this thing is the ringed sideroblasts and also these lab findings. And for sure the causes. Okay. So let's move on with the next topic.